Right now, as you are watching this, there is a silent battle happening inside your arteries. For decades, you have been told to watch your cholesterol. You have been told to cut out salt. You have been told to worry about that bottom number on your blood pressure, reading the diastolic pressure. But what if I told you that new research analyzing millions of patients suggests we have been looking at the wrong things? What if the safe medications you take for heartburn or pain are actually stiffening your arteries? And what if the single most accurate predictor of a heart attack after age 60 isn't your cholesterol level, but a specific gap between your blood pressure numbers that most doctors never even mention? Today, we are going to dive deep into the heart of the matter. We are going to expose the hidden destroyers of cardiovascular health that specifically target seniors. We will reveal the 7 drinks that can scrub plaque from your arteries, backed by clinical trials, and we will uncover the truth about which blood pressure number actually matters when you are over 60. You need to stay until the very end because we will reveal the nitric oxide protocol, a simple daily habit that can relax your blood vessels and lower your risk of stroke by up to 40%. This isn't about expensive prescriptions, it's about biology. Let's start with a terrifying reality check regarding your medicine cabinet. Part 1. The hidden heart killers. We trust our doctors and we trust our medications, but sometimes the cure can be dangerous for the heart, especially as we age. Let's talk about NSAIDs, non-steroidal anti-inflammatory drugs. You know them as ibuprofen, naproxen, or celecoxib. You take them for arthritis, back pain, or headaches. But a comprehensive meta-analysis published in The Lancet found that high-dose NSAID use increased the risk of major cardiovascular events by about 1/3. Why? Because they block enzymes that protect your heart and blood vessels. They cause your body to retain sodium, which raises blood pressure. If you are over 60 and taking these daily for pain, you are playing Russian roulette with your heart. Talk to your doctor about alternatives like topical creams or physical therapy immediately. Next up, proton pump inhibitors, PPIs. These are your heartburn drugs, omeprazole, esomeprazole. They reduce stomach acid. But a study from Stanford University found that PPIs were associated with a doubled risk of cardiovascular mortality. The mechanism is frightening. These drugs appear to reduce the production of nitric oxide in your blood vessels. Nitric oxide is the molecule that keeps your arteries flexible. Without it, they stiffen. If you have been on these for years, ask your doctor about H2 blockers or lifestyle changes. Instead, Part 2. The blood pressure myth. Now, let's clear up the confusion about your blood pressure. For years, you worried about the bottom number, diastolic. But as we age, our arteries naturally stiffen. This causes the top number, systolic, to go up, while the bottom number often goes down. Research published in the Journal of the American College of Cardiology followed 8,000 adults. They found that in people over 60, the diastolic number had almost no independent relationship with heart attack risk. So, what matters? The systolic pressure, the top number, and something called pulse pressure. Pulse pressure is the gap between the two numbers. If your blood pressure is 140 over 80, the gap is 60. If that gap gets too wide above 60 or 70, it means your arteries are losing their elasticity. They are becoming rigid pipes instead of flexible hoses. This slams your brain and kidneys with too much force every time your heart beats. The takeaway? Focus on lowering that top number. Don't let a normal bottom number lull you into a false sense of security. Part 3. The Artery Scrubbers. 7 drinks to clean your vessels. Now for the good news. You can fight back. You can restore flexibility to your arteries. And you can do it with what you drink. We have compiled a list of 7 drinks that research shows can help clear plaque and improve blood flow. Number 7. Green tea. This isn't just a soothing beverage. It is medicine. Green tea contains EGCG, epigallocatine gallate. This compound prevents LDL cholesterol from oxidizing. Oxidized cholesterol is what sticks to your artery walls. A study from Japan followed 40,000 adults and found that those who drank 5 cups a day had a 31% lower risk of dying from cardiovascular disease. Number 6. Hibiscus tea. This beautiful red tea is a natural ACE inhibitor. That's the same mechanism used by blood pressure drugs like lisinopril. A study from Tufts University found that drinking 3 cups a day drops systolic blood pressure by 7 points in just 6 weeks. That is comparable to medication, but delicious. Number 5. Turmeric. Golden milk. We talked about inflammation being the enemy. Turmeric contains curcumin, which puts out the fire of inflammation inside your arteries. A study in the journal Atherosclerosis found that curcumin reduced plaque volume, but remember, you must consume it with black pepper and fat, like milk or coconut oil, to absorb it. Number 4. Tomato juice. It's not just for Bloody Marys. Tomato juice is rich in lycopene. Lycopene is an antioxidant that makes LDL cholesterol less likely to clump together. A study from Cambridge University found that lycopene improved blood vessel function by 53% in patients with heart disease. Just make sure you buy the low-sodium version. Number 3. Tart cherry juice. This is for the seniors with high blood pressure and gout. Tart cherries reduce uric acid, which can damage blood vessel linings. They also contain anthocyanins that make arteries more flexible. It is a potent anti-inflammatory that works while you sleep. Number 2. Beetroot juice. This is the king of nitric oxide. Beets are rich in dietary nitrates. When you drink beet juice, your body converts those nitrates into nitric oxide, which widens your blood vessels. A study from Queen Mary University of London found that 1 cup of beet juice lowered blood pressure significantly within just 3 hours. It literally opens up your circulation. Number 1. Pomegranate juice. This is the Holy Grail. A study published in Clinical Nutrition followed patients with severe carotid artery blockages. After 1 year of drinking pomegranate juice daily, their plaque thickness decreased by up to 30%. The control group who didn't drink it, their plaque increased by 9%. Pomegranate prevents the oxidation of cholesterol better than almost anything else. It acts like a Teflon coating for your arteries. Part 4. The 24-hour heart protection protocol. Knowing the drinks isn't enough. You need a plan. Here is how to structure your day to protect your heart, based on the body's natural rhythms. Morning, when you wake up, your blood is thickest and your blood pressure surges. This is the danger zone for heart attacks. Hydrate immediately. Drink a large glass of warm water. This thins the blood. The beetroot boost. If you can stomach it, have a shot of beet juice or a nitric oxide supplement to open those morning arteries. Check your pressure. Measure it now. If your morning surge is more than 40 points higher than your night reading, talk to your doctor. This is a major stroke risk factor. Midday green tea intervals. Have a cup of green tea between breakfast and lunch and another between lunch and dinner. Keep that EGCG flowing. Movement snacking. Do not sit for more than an hour. Stand up and do 20 calf raises. Your calves act as a pump to return blood to the heart. Stagnant blood leads to clots. Evening, the golden shield. After dinner, have a cup of hibiscus tea or pomegranate juice. This helps manage the post-meal inflammation. Magnesium. Take 400 milligrams of magnesium glycinate before bed. This relaxes the smooth muscles of the arteries and helps prevent nighttime arrhythmias. Part 5. The ankle pump. Secret. Before we close, I want to give you one physical tool. It is called the ankle pump. Surgeons make patients do this after surgery to prevent clots, but every senior should do it daily. Sit in a chair or lie in bed. Point your toes away from you as hard as you can, then pull them back towards your shins as hard as you can. Do this 20 times. Why? Because this activates the calf muscle pump. It forces venous blood out of the legs and back to the heart. It reduces swelling, prevents varicose veins, and lowers the risk of deep vein thrombosis, DVT. It is the simplest, most effective circulation booster you can do, and it costs nothing. Conclusion: heart disease is not inevitable. High blood pressure is not a life sentence. Your arteries are living tissue. They can heal, they can relax, and they can function better. But you have to stop poisoning them with NSAIDs and processed foods. You have to stop ignoring the pulse pressure gap. And you have to start feeding them the nitrates and antioxidants they are starving for. Start tomorrow. Buy a bottle of pomegranate juice. Swap your second coffee for hibiscus tea. Do your ankle pumps while watching TV. You have the knowledge. Now you need the consistency. Your heart beats for you 100,000 times a day. Isn't it time you did something for it? If you found this video helpful, please share it with a friend or loved one.